When there is an excessive amount of CSF that is being formed, now what happens is, now it is a task of the surgeon to intervene, and the physician here is going to produce a mechanism called as a shunting mechanism, whereby he is going to drain the excessive CSF from the ventricles to any of the body cavities. If the shunting, so this is called as a CSF shunt or a cerebrospinal fluid shunting. So depending on the space or depending on the cavity where the CSF is being shunted, we have very specific codes. Say for example, if the CSF is being drained into the cisternal space of the cerebellum medullaris, which is actually a space between the cerebellum and the medulla oblongata, then we have a specific code for that. Perhaps if the provider is going to drain the excess CSF into the jugular vein or into the right atrium, we have very special codes. Or sometimes if the provider is going to drain the CSF into the peritoneum, we call that as a ventriculo-peritoneal shunt. So we will have to select the appropriate code for that.